Welcome to another edition of Your Health Matters. I am Shay Brown, family nurse practitioner, plant-based nutritionist, health and wellness facilitator. I do a lot of things. I have many hats, so we're not going to go into all of them. But you guys know me as Dr. Shay. Today we have a very special guest on today. We will be talking about asthma and obesity, how the two correlate together, okay? We want to get into asthma and obesity, but we want to think about how does it really affect you? How does it affect your family? Most importantly, how does it affect your children? So this segment of Your Health Matters is a segment that you do not want to miss. And we have a very, very special guest on with us today. We have a guest on that specializes in obesity and with asthma, and someone that also specializes in allergies as well. So I am not going to introduce her, but we do have her name up here, Dr. Carrie Reller, and she's going to introduce herself and tell you guys a little bit about herself. Dr. Reller, take it away.
Hi, everybody. Yeah, I'm Carrie Reller. I'm board certified in family medicine and obesity medicine, and I also have a special interest in allergy and asthma, and I work in Clearwater, Florida at Clearwater Family Medicine and Allergy, where we do lots of everything I just mentioned.
So, Dr. Reller, what got you started in asthma, obesity? What really got you started with all of this?
Well, that's kind of an easy question. My father actually is an allergist. So I'm kind of late to deciding to become a doctor. I was an engineer first. I actually worked up in Baltimore, and then I quit my job and went to pre-med at Hopkins, and then med school at University of Maryland. And I trained in family medicine at University of Maryland as well. And then I was going to go into sports medicine, and my dad convinced me to move back to Florida. And he's like, I'll teach you everything in allergy and asthma, and you can do it as a family doctor. So I did that. I moved back to Florida 6 years ago, but I really, I guess throughout my whole life, I've had a passion for health and wellness as well. And I, in recent years, discovered obesity medicine. I think boredom searching and during COVID, I'm not sure. But anyway, it led me across it. And I was in shock that I didn't even know obesity medicine existed when I was in residency.
Ooh.
And it's actually something I do want to bring back to my residency, but I think some people know about it now. But so I ended up, studying for that and passing board certification. And I've been practicing and kind of starting a program at our office as well.
Okay. So with the asthma, I understand that your dad said he would teach you everything. So lucky you. I had to learn it all on my own. But your dad said he would teach you about that. What made you so interested in obesity?
Well, I mean, I kind of struggled with my weight since I was 14-ish. I mean, I think it affected my athletic performance in high school when I felt like I was putting on some weight and not as fast as I could have been. Like maybe I wanted to maybe play in soccer, college and soccer, to play college soccer. And, I wasn't as fast as I could have been. I saw my brother growing as a teenager, eating everything he wanted. And I'm like, oh, I thought I was supposed to do that too, right? Well, that doesn't work for a female who's going through puberty. So I started putting on weight like in high school. Mm-hmm. Not a significant amount because I was always very physically active. But it's something that, bothered me. So I did actually enroll in Weight Watchers, in high school and then again in college. And I still kind of sometimes do that too, but it at least introduced some things to me. Now they may have, changed their policies and things like that, the way that research has come on nutrition. Mm-hmm. So I think they have improved as well. But I think that my own struggles obviously had made me interested in nutrition and wellness in my whole life. So it was like a no-brainer when I found out that was an actual medical specialty. And I totally want to, it's totally important to get that out there, the information about it, and then use it in the office to help my patients because they really can improve their other medical problems without treating their lifestyle problems, which as you know, may include
Mhm.
weight. Yeah.
Absolutely. Absolutely. So, being that you have the background with, well, experience with obesity and the medical background and knowledge um, with asthma, um, how do two correlate together?
Yeah, so it's actually interesting. There's been a lot more research on the two in the last, I don't know, 15, 20 years as the obesity epidemic has increased. There's also been an increase of an asthma epidemic. So they kind of been going hand in hand, and that's in the adult and the pediatric population. I think for overweight patients with a BMI, 25 to 29.9, they have, I think there's 32% chance of developing asthma.
Mm,
And for obesity, which is 30 and above, there's like an 82-ish% of chance of developing asthma. So there's also more things that show correlation. Now it's not causation, so I'm not
mhm.
that one is causing the other, but they're certainly correlated, and definitely more research is showing that.
Absolutely, absolutely. So, do you find yourself treating more children with asthma and obesity, or more adults?
So our practice is definitely more adults. Yeah.
Hmm.
The It's just in general, it's more adults, I think, for our practice. There is a pediatric allergist not too far from us that might see more of that, but I think we don't really see the childhood obesity asthma association much in our office. Yeah.
Hmm. Hmm. All right. So, when you have your adult patients that are struggling with asthma, do you find that um, with your background of knowledge with obesity, that
Mhm.
with weight loss, that their asthma could improve?
Absolutely, it can improve. I think the hardest part is broaching the subject, right? First thing is, do no harm, right? So
Absolutely.
I think a lot of people who have gone to other doctors or like cardiologists or anyone, and they tell them to, lose weight, eat less, exercise more, and they've been burned so many times that it's really a sensitive subject for some.
Yeah,
And
it is.
they often don't even like the word obesity. And I've
Mm-mm.
been trying to teach my patients that it's not a four-letter word, right?
Mhm,
It's okay, and it's a disease, and
mhm.
it should be treated as such, right?
Absolutely.
Yeah. So it's hard to broach the subject when I'm seeing just like one of our asthma patients.
Right.
And if they come to us for help, then obviously I'm going to say something. The other problem is that if they're really bad asthmatics, we have to treat them with medications that may, you know, make it more difficult to lose weight or make their weight even worse because their asthma is so bad.
We have our first question already. We have Janine Cochran. She is like one of our weekly questionnaires. She is always on our show. First question. Can
Mhm.
asthma cause water retention?
Yeah, so asthma itself cannot cause water retention, but what
Mhm,
happens is if you're having an asthma exacerbation and you have to go on systemic corticosteroids, so prednisone or
mhm,
Medrol, if you
mhm,
may have heard, those medications cause water retention.
mm,
So used in the short term, they don't typically lead to weight gain except for the water retention, which would resolve or get better shortly after.
mhm.
But long-term use of those medications are not good. Yes.
Okay. We also have another question for you.
Hmm.
I'm sorry, we're getting started early with the questions, okay?
That's okay.
All right, we have Lisa Dunlap. Good evening. Do you think that having asthma contributes to obesity? Having trouble breathing seems to limit the ability to exercise. Mm, we were talking about that earlier a little bit.
Yeah. So absolutely, asthma is at risk of developing obesity. So actually, 50% of patients who have asthma have obesity, and I'm not going to say one causes the other. We don't really know which one comes first, kind of thing. But
Mhm,
someone who has asthma at a young age and has difficulty breathing or not well controlled asthma, then that is going to lead to, like you said, the inability to exercise. So yes, that can cause, and just not just exercise, right? But normal movement every day, which we call like neat movement, whatever, neat movement. Anyway, so it's like just getting up and going upstairs, right? So that's going to
Right.
cause them shorter breath. So they're not going to want to move as much. So yes, that can lead to obesity. And not only that, so that's poorly controlled asthma, right? Then you talk about asthma that might be better controlled, but maybe they're better controlled with those steroid medications that can also, like I said a second ago, possibly lead to weight gain as well, depending upon how they're used.
Mhm, mhm. So, question for you, not from the audience, but for myself. When
Mm-hmm.
we talk about the children, um, when you have a child that that could be asthmatic,
Mm-hmm.
um, how can the parent differentiate from a child being obese? And when you say the word obese, and it's hard to say that word,
Mm-hmm.
so I like to say an unhealthy weight is what I
Mm-hmm.
tell my patients. You know, I, the way I bring the subject to them, I'm like, well, let's talk about, you know, we're going to have to approach this unhealthy weight. We all know that it is because they don't like that old word. Okay. That's just like saying a slur. You B, you F, you M, that's a slur, So I like to say unhealthy weight. So when we talk to parents and they have a child of an unhealthy weight.
Mm-hmm.
How can they differentiate from a child being, I don't want to say lazy, but the child say, well, you know what? I don't want to go play today because I just feel short of breath. It makes me feel short of breath. But that child could be experiencing a little bit of asthma without all the signs of wheezing because as medical professionals we hear those wheezing signs, but to a naked eye that don't know, how would parents know? How
Yeah,
could they help
absolutely.
what I'm
Mhm.
asking? How could they help their child?
So one thing would be to look at their history, right? So
Hmm.
if they, had problems at a young age, like maybe in infancy, and they had, difficulty breathing, then it's unlikely that it was weight related, right? So one is their personal history. Two is the family have any history of asthma.
Hmm.
Three, there is the exposures of, smoking in the household, or just environmental exposure as well. That could be a risk factor depending upon where you live. So
Hmm.
there's those things, right? You can look at, if there's a historical component. The other thing is starting maybe to work that patient up or work them up and do testing, right? So
Hmm.
if they're old enough, they could go into the office and do a breathing test, right? At
Hmm.
rest. So
Right.
when they aren't trying to run or something like that, to see if that's the case. Or if that ends up being normal, it could be exercise induced asthma. Like how do you tell the difference, right? We can't really
Absolutely.
do that without starting to work it up. And then the other thing that you can do is do some allergy testing and see if they have any allergy symptoms as well, like hay fever, like runny nose, itchy eyes, runny eyes, things like
Hmm.
that. So if they have those components, it's
Hmm.
probably going to be more that atopic traditional asthma, right?
Right.
And it could be made worse by the weight, or vice versa. But I think you need to start working it up before you can definitely say, oh, his or her symptoms are related to weight, or they're related to asthma, or they're related to neither or both.
Absolutely. Absolutely. Thank you so much. So we have another question from Ms. Cochran. Can you develop asthma later on in life?
Yeah, absolutely. So you don't even need to have a previous history of that. Now, later newer research says, so we're mostly talking about obesity related asthma tonight. So
Hmm.
I guess I'll kind of answer to that. So if someone has obesity, or has overweight, then they do have a risk factor of developing asthma later
Hmm.
in life. Typically, it ends up being female greater than male for some reason. And it's more difficult to control. It's more of a restrictive breathing pattern than an obstructive breathing pattern like traditional asthma.
Hmm.
But yeah, you certainly can develop asthma later in life.
So, when we talk about breathing patterns, can you explain to the audience someone that's actually what happens to their lungs when
Hmm.
they're actually experiencing an asthma attack? Can you like describe it? It's like with me when I was in school, I had to break things down like colors. All right,
Hmm.
like a 5-year-old will be able to understand it. Match this, match that. We really want to break it down to where a 5-year-old will understand what happens to your lungs when you're actually having an asthma attack. Can you do that for our audience right now?
Yeah, so basically there's something that is causing it, right?
Mhm,
Usually let's say in traditional asthma there's an allergen or exposure to something, I don't know, pollen or something, right?
mhm,
That makes the I guess the smooth muscle cells, so these small things that are in your lungs in the small airways, and
mhm,
then they make them proliferate with mucus and narrow, and that's like when the patient starts like having that tightness in their chest and difficulty breathing. So basically the tubes of the lungs are going from that to that, they're narrowing, right? And you
mhm,
feel tightness in your chest, you start having difficulty breathing, you might be wheezing. So that's what happens with traditional asthma, right? Now
mhm,
you add on that mechanical impairment and airway impairment from other additional inflammation in obesity related asthma, and it's even worse and stronger. And not only that, they can't fully expand back their airways as they
mhm.
could with just regular asthma. So it's a little bit more, it's less reversible, if you
Right.
will,
Mhm.
with obesity asthma.
Absolutely.
Mm-hmm.
All right. So when you were mentioning something about triggers, what are some of the triggers of asthma?
So okay, traditional asthma. So there is allergic related asthma. So atopic things. So pollen, dust, smoking. Um, what is it? The perfumes that can
Mhm.
trigger some people.
Yes.
Other chemicals. Like in our office, we have a policy where you cannot, wear
Yep.
perfumes in there because it's really bad. It gives me migraines, but it gives everybody else asthma. And then smoking.
Yes, a
I
big
don't know if I
trigger.
said that already. Yeah, those are the normal typical triggers of an asthma exacerbation. Yeah, or if you have a reaction to an injection or something like that, like
Mhm.
uh, I guess it's more anaphylaxis, but it could lead to the same thing, asthma exacerbation. So
Now, do you think that, well, not think, in your medical opinion, we don't want your, but in your medical opinion, do you, parents that smoke,
mhm.
can they cause um, their children to have asthma later on?
It's the same kind of thing. It's like a huge risk factor, but I can't really say it's the absolute cause of that. There may have been some genetic component that they might have been developing. It might be other environmental exposures. It could
Mhm,
just be in their, makeup of anything else. So we definitely say don't do it. It can make it worse, right? But
mhm.
I don't usually necessarily say it's directly related to that reason. I certainly wouldn't encourage it.
All right, another question from Miss Cochran. She asks a lot, trust me. I thought this would be another one. Does children with active asthma have greater risk for developing obesity? Mm,
Well, that's kind of, yes, I think so. And that is kind of similar to what I said with even I don't know if we said it the opposite. So basically, someone who has asthma has a greater risk of developing obesity, oftentimes due to the treatment of the
right.
asthma, right? And
Yes.
then the other way around, someone who has obesity oftentimes has the risk of developing asthma. And then there's this whole other overlap thing, which maybe we haven't figured out yet.
Hmm.
But yes, anybody, it doesn't have to be a child, but anybody with active asthma is at risk for developing obesity. And so, I mean, I haven't gone into the detail of the medications that we use, but the biggest one when you have an acute asthma exacerbation is usually going to end up being oral, systemic or oral corticosteroids. So
Hmm.
prednisone or prednisolone, if you've heard of
Hmm.
that for a
Yes.
child, then or the Medrol. That's what we use because it is the most effective at stopping the exacerbation, right? So
Mhm.
you use that every, I don't know, once or twice a year, maybe not so bad. Like the effects won't be so bad. But if they're so hard to control and you have to have more and more bursts of that steroid, it's basically elevating cortisol, right? And
Yeah.
I don't know if you've ever gone over the problems with elevated cortisol on your show here, but it's not good. Basically, it can lead to weight gain, musculoskeletal wasting, insulin resistance, metabolic syndrome. So that's if you
It's not
have
good.
real, yeah, it's not good. So that's the systemic oral steroid that can cause that
Mhm.
problem. But then there's also the controller inhalers that we need to use. So those are Advair, Dulera, I don't know which ones you guys have heard of, Brio, Trelegy, Symbicort. Hopefully I'm not an advertisement here, but anyway, so we have to use those medicines to prevent exacerbations, right? So those are
Mhm.
the inhaled steroids, so the inhaled corticosteroids. So they're really only supposed to hit the lung.
Mhm.
There is a little bit of data that it may also lead to obesity, but honestly, if you aren't treating the asthma, the uncontrolled asthma is going to lead to obesity even faster for the
Absolutely.
same thing that somebody asked earlier, right? They can't
Mhm.
breathe, they can't move. You're
Mhm.
going to, yeah, not do so well.
Okay, another question from Champagne Shiner. Are asthma and obesity a product of parenting? I can, I know you can be born with asthma, but is the correlation parenting?
I don't think there's any like data on actual parenting, but typically in cultures, like the things that you're raised with are part of, I guess, you're also not just your genetic material, but the way that you do everything. Maybe it was in your culture to smoke and that, didn't help. Maybe it was in your culture to eat certain foods that tended to not be favorable to having a lean body. So eating, high calorie, high fat foods that maybe didn't have as much nutritional value but tasted so good
Mhm.
that, that can lead toward weight gain, and then that may eventually lead toward obesity as well. I wouldn't necessarily say it's like parenting, but I think we were talking earlier about like more like traditions, right?
Mhm.
You have a tradition to make cookies at Christmas with your family. You have a tradition to go out Halloween candy. Like there's all these traditions that unfortunately in our Western society are leading toward bad habits. And don't get me started with sugar and food addiction, but it leads there. And that unfortunately is kind of helping everybody keep weight on and not have fat loss. And then if that happens, then maybe leading toward asthma as well.
Absolutely. So, I have a question for you. Is there a difference in the treatment response
Mm.
in people that are of a what we call a normal weight and people that are of an unhealthy weight? The treatment response.
So it's harder to, I think you have to differentiate kind of what kind of asthma when the onset was first. So if they have that late onset asthma, which is more
The
women than men,
exacerbation.
greater than 12 years old,
Mhm.
that isn't atopic. So it's not usually related to allergic disease.
Mhm.
There is, it is more difficult to treat.
Mhm.
They have lower quality of life scores. They have greater symptom scores, and yeah, they don't respond as well to bronchodilators, so your albuterol. They don't respond as well to the inhaled corticosteroids, and they don't respond as well to systemic steroids either. So it's just overall way harder to treat because it's not this traditional pathway that we've always been, I guess we've known longer about. So
Mhm.
there's more treatments for it.
Mhm.
So when they're falling on this other side, which is we call non-Th2 pathway, we don't have the treatments that are working as well.
Okay. So we have another question also. Is it true that you can grow out of asthma if you're doing things correctly?
Yeah, so people that younger, kids or whatever, sometimes they have it really early on in childhood and they can grow out of it and never have it again. And guess what? They can grow out of it and somehow get it when they're 70 again. But it could be for a totally different reason. So it's not as clear cut as it used to be. You can grow out of it and you may get lucky and never have it again, or you can present with a different type. I don't know. Yeah, it really it varies.
So, what are some of the treatments that they have? Say, for instance, that um, we have people that trying to figure out how to phrase the question to you. People that are active, okay.
Mm-hmm.
Um, we always tell people to, use your inhaler prior to exercising.
Oh, exercise induced asthma?
Yeah, yeah. But they use the inhaler and it's not working. So,
Mm.
what are some other options that they can do?
If you're talking about for just exercise induced asthma,
Mhm.
yeah, um, there isn't that much. So so basically you're supposed to use it at least 45 minutes prior to activity.
Mhm.
And that's because typically the actual exacerbation happens when you stop exercising.
Mm.
Yeah, I mean, you can have tight chest before, but typically the real diagnosis of it is you're having the symptoms after exercising. So you're supposed
Mhm.
to use the albuterol, that bronchodilator, 45 minutes prior to activity. Some patients, like actually, we had a young student who was a soccer player, and she actually ended up going to play up north in your area, and she had trouble with the cold. Cold is another trigger for some people for asthma. And we tried, we added Singulair, so that's Montelukast,
Mhm.
to try to help with that too. There's some data on that. There's a little bit of data of putting them on the inhaled corticosteroid as well. But if it's really truly only exercise induced asthma, if it's real hard to control if they're not doing that bronchodilator. But then also, I mean, sometimes during a game, she may need to have a systemic steroid to help her get through that game.
Yeah. Yeah.
Mm-hmm.
So,
It's a whole nother beast, if you will, though.
yes, it is absolutely. So, um, I was talking to you earlier about food as medicine. All right,
Mm-hmm.
food can either help us or it can hurt us. Um, what are some of the? I know that asthma can cause. Um, well, some of the foods can cause people to have asthma. Not so much cause people to have asthma, but I'm thinking that a lot of our foods
Mm-hmm.
are inflammatory foods. Is what I'm trying to get to. Can cause people to have asthma. Can you just elaborate more on that?
Sure. Yeah. So, basically, obesity and asthma are both inflammatory diseases. So some people don't know that about obesity, but one of the big components is that those fat cells release certain inflammatory markers, or we call cytokines or adipokines, whatever the fancy word, right? So they're
Mhm.
releasing these things, and they cause inflammation all over the body, but especially also in the lungs.
Right.
So and then that's part of how it's contributing to asthma. But as far as foods, it's certainly known that the highly inflammatory foods such as saturated fats and processed foods and refined carbs and sugar can cause inflammation in the body. The
Mhm.
same way, because they're increasing insulin, and then insulin stores the fat and then makes you fat storage hormones. So you're getting more fat, so you're going to release more of these inflammatory markers, right? So
Mhm.
those foods are definitely maybe kind of detrimental to the asthma and obesity. But also, there was some study that I was looking at that showed that after eating like a really highly saturated fat meal, that the breathing test was actually decreased in an asthma obesity phenotype. So a person with asthma and obesity, and it was decreased like right after having the meal. It's kind of impressive. So the breathing test is that
Absolutely.
if anybody has asthma, it's a good way to measure basically their lung function, their lung capacity, and it's typically something we do in the office every time they come in. So it's measuring the amount that they breathe out in 1 second and putting that over like their lung capacity. So that is in generally that FEV1 is what it's called, the forced
Mhm.
expiratory volume in 1 second. And
Mhm.
that is reduced in asthma. And it's saying it's even further reduced when they have that saturated fat meal too. Yeah. And in obesity, it's all mildly reduced, and the lung patterns and volumes are a little bit different in obesity asthma as well. Does that answer your question?
Yes, it does.
Okay.
Can you explain the difference in the what we call short acting and long acting inhalers? Because
Mm.
sometimes people can have an asthma attack
Mm-hmm.
and actually use the wrong inhaler.
Mm-hmm.
So just kind of like, can you just get more into that and
Sure.
explain the difference in the two and why you should make sure you don't use the long acting inhaler for an
Mm-hmm.
asthma active attack?
Mm-hmm. First, I'll tell a cute story.
Okay, I love
I
stories.
had this very nice gentleman. He was a priest, and he had his albuterol emergency inhaler, right? So that's the little puffer. I wish I had one here to show you, but anyway, uh, he never. I asked him, "Oh, did you use your inhaler?" Blah blah blah. Like if he had an attack. Yeah, he's like this. He never put it in his mouth.
Excuse me?
So you got to put them in your mouth, right? So you have to know which one to use, and you got to know how to use it. So that's super important. So the cute little old guy never put it in his mouth. So it never really helped him. But anyway, so the short acting one, they're almost like Ventolin, Pro Air,
Mhm,
levalbuterol, and albuterol. Those are short acting. Those are meant
mhm,
to be used, when you're feeling short of breath, wheezing, or coughing, and you want to do 2 puffs every 4 to 6 hours as needed. If you need to do it more than that, you start thinking about calling your doctor, going to the ER, something like that, or having what we also have people on an emergency like medication plan.
mhm,
And those are the ones you shouldn't be using every day. If you're
mhm.
using them every day, then you're not controlled. If you're using it more than twice a week, you're not controlled. So that's the short acting ones. They expand your bronchioles, right away. And then there's the long acting ones. So the long acting ones in asthma are always paired with the inhaled steroid. Because if you don't, then I think I forget actually the outcome, but there's a heart issue related to that. So you always, in an asthmatic, have to have the inhaled corticosteroid with the long acting bronchodilator. And
Yes.
that's the uh, I guess like the Advair, right? So it has a steroid and it has the long-acting bronchodilator. So
Mhm,
fluticasone, salmeterol is the drugs in those. And those, depending upon which one it is either once a day, like 1 puff once a day, 1 puff twice a day, 2 puffs twice a day. It depends what either your doctor tells you or the manufacturing allows for, because they
mhm,
have a lot of newer ones on the market that are only 1 puff once a day, which are fantastic for compliance.
mhm.
But I don't know. Some people like to have the extra puff a day, so it really depends on the
Yeah.
patient. And then they have to be able to use the device too. So there's a lot of teaching that has to be done with all these fancy inhalers that
Yes,
asthma needs to treat it. Yeah.
absolutely. They're always coming out with something new.
They
Always.
are. It's amazing. So, like I said, I learned from my dad. I mean, he's been doing this for 40 years or 42 years. So, none of these things existed when he started. He always told me allergies would be cured. Like, it's the exact opposite.
More
But
and more is
anyway,
happening. The
yeah.
world is changing, okay?
Yeah.
We have COVID now, all right? The world
Yeah.
is changing.
That definitely doesn't help. So, speaking of COVID, we've had, new onset asthma related just to COVID. Yeah.
Whoa.
So people who have had normal breathing
Yes.
or no breathing in the past at all whatsoever are now presenting with abnormal lung function studies, or even worsening,
Yep.
depending upon who they were,
Yep.
from COVID
COVID.
and
Yep.
asthma. And I'm definitely going to associate that with obesity as well,
Whoa.
because as I'm sure you've heard in the news, patients with obesity were having worsening outcomes from COVID as well.
Yep.
Yeah.
Yep. 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 It affects those lungs. Yes, ma'am, it does. So
Mm-hmm.
as we're talking about the little gadgets, okay, can we
Mm-hmm.
just explain to our audience what a spacer is and how is it used
Oh.
and what is its purpose and is it really important?
There's conflicting evidence there. We're not a big spacer user office, but where I trained, they use spacers in everyone. And in kids, it can help because it's really, it's a So basically, on the inhalers that are the pump, they have this long tube that you put into your mouth,
Mhm.
and then you just have to you don't have to time it. So you can just
Right.
pump it, and then they inhale through the spacer. So it's just a long plastic tube that you add on to your inhaler,
Mhm.
and it helps with kids because they're not going to be able to control that device very easily. But and maybe in some older adults as well, but sometimes we think that they lose a lot of the medication on the siding of it and they're not getting the dose, so we don't typically use it as much. And then they have a bunch of different devices like mist ones, and more like powder inhalers that don't need that the spacer doesn't really work for. Basically, you can't put a spacer on a Trelegy or a Brio, like, so that's a
Right.
different device. It's a
Mhm.
circular disc device, and
Mhm.
you just slide it open and then suck it in. So that one isn't going to work with a spacer.
No, no, it's not.
Yeah. So it really depends on, I think, insurance coverage too, because a lot of patients, I think, depending upon what their insurance is, what device they can get. So
Mhm.
obviously, if they're going to use a device that doesn't use a spacer, then we can't do that. But I think in pediatric asthma, they use it a lot more.
Okay. Two-part question, okay?
Hmm.
For a person trying to change a healthier lifestyle and lose weight, and wait a minute, for a person trying to change to a healthier lifestyle and lose weight, and is it more difficult for them?
If they have asthma.
Um, can bronchitis be mistaken for asthma? And can you explain the difference in the two? I believe that's it.
So is the first one about a person with asthma that's having a trying to do a healthier lifestyle and lose weight?
Yeah,
Probably.
yeah, I
Okay.
think it is. Yeah, and they're
So
trying to. I
I
think that's.
think yes, especially first their asthma has to be controlled, right, in order
Mhm.
to not need systemic steroids and
Mhm.
have exacerbations. So they need to do everything they can to have good control over their asthma. And if they keep having exacerbations and they keep needing medications, then yeah, it's going to be a lot harder to lose weight, and they're not going to feel good and want to exercise or want to do anything. They might be more depressed, right? It's just not, it's a vicious circle. Asthma is very complicated and it's, a severe disease. So I definitely think that if their asthma is not well controlled, it's going to be harder to lose weight. In
Mhm.
general, if they have like mild asthma, not more than that, they should kind of be functioning more like a patient without asthma, and they should have a little more success. And I think if you get nutrition right, like we were mentioning earlier,
Mhm.
it's really worth it to see if it can change your asthma and
Absolutely.
inflammation in your body and see what happens. Yeah.
Absolutely, absolutely. As you're talking about the nutrition and the obesity, I mean, with obesity and asthma, the lung volume it decreases with obesity.
Hmm.
So with the weight loss, I mean, you're expanding your lung volume. So it would behoove and maybe encourage clients, patients to lose the weight, eat a healthier diet, eat foods that are healthy fats, not high in saturated fats,
Hmm.
avocados on a piece of toast. I have a lot of clients that are always posting that on our little blog. One client, Dr. Shay, I have avocado and toast. That's a healthy fat. And I'm like, yes, that is a healthy fat. So we want to encourage our clients to eat healthier fats, not fats that are high in saturate that are
Hmm.
saturated fats. And those fats includes cheese. People don't think that cheese is very high in saturated fats. It is. It's made from an animal. All
Hmm.
right. So you want to make sure that you watch the amount of cheese that you're eating. Your red meats. Oh my God, the red meats in itself. I'm not telling people you can't have red meat, but have it every now and then. But every then now is what I
Right.
would tell people. Um, this Western diet, I'm telling you, it's really taking a lot of people out. And it's not that
Hmm.
it's keeping us in business. You overworking us. I mean, basically, that's what's happening. I mean, we're fighting so hard to encourage people to change their diet, and we're walking on eggshells around the O word to try to
Hmm.
approach people about the O word. And as we're walking on those eggshells, you know, me, I'm just coming out. I'm That's how I am. I'm just coming out. I'm just talking to the patients the best I can. But instead of saying the O word, I use that word that I say, that unhealthy weight. So
Mhm.
we're hoping with these podcasts that we're getting through to somebody. And again, we have another question from Miss Cochran. So
Okay.
we're going to ask the question. I mean, I don't know if you can see them or not, Carrie, but back when we were children, it was rare to see a child or an adult with asthma issues. What has changed between? Yeah, it was rare. I mean, as much as we see it now, that is an excellent question.
Yeah.
What has changed?
Well, that's kind of like my point with what my dad was saying. He thought it was all going to be cured,
I'm with
right?
your
But I
dad.
think something had to be different, right?
Yeah.
So, I mean, I guess we don't 100% know, but that's what we're talking about here, the correlation between obesity and asthma, right? So like you were saying, the Western diet has changed everything we're eating, and we're seeing more of this new non type 2 inflammation of asthma. So I think that would be contributing from the diet and the population perhaps, and the
Absolutely.
fact that we don't move as much, and
Mhm.
that I don't know, we're more stressed, or we're it's just everything really. Excuse me.
We move so fast, we just don't take time anymore. And no one cooks at home anymore. We Grubhub.
Yeah,
Everything.
everything is about convenience and efficiency, and we're not
Absolutely.
using those whole food plant-based products, or just even whole food products. We're just going for conveniency, fast food, processed packaged food, things that look healthy but really aren't. The food industry kind of lies to everybody about what's on something. You know,
Yes.
it's not easy to navigate the grocery store anymore. I was trying to find bread for my family that didn't have added sugar, and I couldn't find it. There's
Oh
no
my God.
bread with added sugar.
You read labels?
Well, I hope everybody does.
Oh my God. You read labels? I'm sorry. I read labels. I really, everybody don't read labels. And that's one thing that I'm really teaching
Mhm.
my clients is how to read labels.
Yeah. A lot of people don't know how to relate, but so it's important to have that
Yeah,
as a component of, yeah,
absolutely.
teaching. Mhm.
Absolutely. So besides the steroids that we talked about, does asthma medications, do they cause you to gain weight?
So yeah, I think I already alluded to that with the systemic or the oral corticosteroids.
Hmm.
So the prednisone, the Medrol, the prednisolone,
Hmm.
long-term use of that definitely leads to weight gain,
Hmm.
insulin resistance, metabolic syndrome. So basically, those are all fancy words for, cholesterol abnormalities, blood pressure abnormalities, weight abnormalities, right?
Hmm.
And then the inhaled corticosteroids, I don't know how good the data is, but there is some sort of, association with weight gain with that too. But I just want to stress, because I don't want people to stop their inhaled corticosteroids if they need them for asthma, that uncontrolled asthma is
Hmm.
going to make you gain weight more than that inhaled corticosteroid. So yes, they might, but it's one of those things you can't take away, right?
Absolutely. You definitely cannot take them away. So we are coming up on 8:44 of the hour. Carrie, we have been going at it for 45 minutes. All right. So, is there anything
Great
that you want?
questions. Yeah.
Absolutely excellent
Mhm.
questions. Is there anything that you want to bring to our audience? We have a minute. There's no questions on the board right now that you want to maybe bring to the audience that we have not maybe mentioned in reference to allergies, in reference to asthma, in reference to obesity, anything that you want to bring to our attention.
I think the biggest thing is that treating asthma and obesity as both inflammatory diseases, and kind of understanding that obesity can have inflammation anywhere in the body, right? And that, means lungs too, and that's how it can be affecting the asthma. And then because of the weight, with if you have asthma, it can be, I'm sorry, if you have obesity, you have the risk factor of developing asthma, and it can kind of shrink those lung volumes, make it harder to be treated. So I think the best treatment is weight loss, right? and eating those non-inflammatory foods, obviously. But weight loss can improve asthma. It can decrease the need for medication for asthma. It improves the quality of life scores of the asthma patients. Obviously, it makes it easier to treat them. What else? I mean, weight loss and it helps overall in general, just improve asthma and, any other risk factors, obviously, as well. How beneficial is exercise?
Well, Emily Brown has a question. How beneficial is exercise if you're asthmatic? My son's asthmas will be triggered by numerous things, but staying active was not a trigger.
Well, that's awesome. If it's not a trigger
Oh, yeah,
to
it's really a trigger.
to your asthma, then I wouldn't have any problem with it. It's actually better because it helps expand that lung function and open
Mm-hmm,
those airways, and
mm-hmm,
really is good for you for the lungs and for the cardiovascular health.
mm-hmm.
So I think it's excellent if you can tolerate it. The other thing that people who have asthma have trouble with exercise is because they want to go outside for a walk or a run and they're allergic to the outside, right?
Mm,
So especially like in spring or fall, they have that allergic asthma phenotype as well. Then they're going to have, nasal congestion, congestion in their chest, and they won't do very well exercising outside. So there's a lot of excuses we make when, you could have, can try to help them realize, well, you could do that inside at the mall, whatever, but also to go get treatment from, a
mm,
board certified allergist who can actually test you and work you up for allergies and
yes.
give you allergy injections if needed, because they work. They're old school, but they work really well. Okay. So that's what I would do if I was wanting to exercise outside, but having some of those symptoms. But if there's exercise is not a trigger, go for it. Probably make you feel good.
So, can you talk more about getting allergy tested?
Sure.
We talked a little bit about that, but I don't think that our audience really understand the
Hmm.
need, the importance of getting
Yeah.
allergy tested. It's nothing that is invasive. Okay.
No. Yeah. So especially, it's much easier. So in kids, sometimes they do just the blood testing, but the blood testing isn't very accurate. So it's
Hmm.
really recommended to do the skin testing. And it's
Hmm.
just little plastic things that poke your skin. Now, we're pretty old school in our office and do only like one at a time on their back. And that's just the traditional way of doing it. I think it is the best practice, from someone who's experienced doing it. They also have like panels where you might do like 6 at a time on your arm, but it doesn't hurt. It's just a little like pinch, if even. And that is the pinprick test that's on
Hmm.
the skin. So they give you little drops of the allergen syrups. We use the most common ones that are in our area, right? So
Hmm.
I'm probably not going to do a tree or something that we don't have in Florida in our test serums.
Hmm.
So and then they twist it a little bit into the skin, and then you wait 15 minutes and see if a hive basically develops, right? So a reaction, is it red, is it raised, is it itchy, kind of thing.
Hmm.
And that's how they determine if you're allergic. You kind of measure the different size of the reaction. And then if there's like no reaction at all, we'll go ahead and do the next step. In some cases, it depends which allergen it is, and do something called the intradermal test. So they inject just a little bit of the allergen under the skin, kind of like a TB test, if you've ever
Hmm.
had that for whatever reason. So that's just a little bleb under the skin. And that is to not miss anything that we may have been missed from the skin prick test. You don't do that on kids really, but that's how the penicillin allergy testing is done too. You need to do these little intradermal things. So by taking, and then you measure the size and the wheel and the flare of that too. So if it's a red or if it's raised. And that usually gives enough information to determine, what you may be allergic to.
Okay.
So that's allergy testing, and that's the traditional for environmental allergies that we do the skin testing on the back or arm or whatever. And then taking that, we create personalized serums if the patient is bad enough that needs to go on allergy shots, and that we put in, it's kind of like a formula, and you only can mix certain things with certain things. So you have to kind of know what you're doing. But anyway, it's all individualized to the patient, incorporating all the things that they're allergic to. And then you would start on basically it's vaccine against all these allergens that you're allergic to.
And
Does that make
some of the
sense?
things that, yeah, it does make sense, but some of the things that, you check for allergies, it could be like food allergies to strawberries. It could be allergies to cats, pollen,
Mm-hmm.
dust, mice. It could be an allergy to anything, right?
So we only typically do the most 7 common foods, and you don't do intradermals on foods.
Okay.
They're all just irritants, so they're going to
Mhm,
react regardless. But yeah, we
mhm,
usually do cats, dogs. If there's some weird animal, we'll add that in. And then dust mites is a big one. And
mhm,
so yeah, molds, trees, weeds, grasses are the biggest
mhm.
classes of the things that we do, and the ones that are specific to each area of the country. Yeah,
Okay.
but the food allergy, you can do a whole food panel. Usually, we're food allergy is a whole nother topic, but we just do the 7 common foods on the
Mhm.
whole allergy panel.
Okay. Great. Thank you so much. All right,
Mhm.
we are coming up at 8:52. Geez, that was a lot. That was a lot of information, a lot of great information. Okay,
Yeah.
so any other questions out there, guys? Dr. Reller is here with us for another 8 minutes. Dr. Reller, again, is there anything else that you want to bring to our audience today? I cannot tell you how much I am so appreciative for you coming on the show today to talk to us about asthma, allergies, and obesity. Um, a lot of good information and a lot
Mhm.
of lot of great questions.
It's been a
So
lot of fun. Yeah.
yes, yes,
Mhm.
absolutely. So, for all of our viewers that may have more questions for Dr. Reller, this is her website, correct?
Yes, yeah.
Okay. You guys can find her at www.cfma.health. Excuse my voice, that's why I'm asking questions and letting Dr. Reller talk as much as she can because my voice is a little gone.
I
So,
think if you have questions, I think Instagram, like with the direct message thing, that's probably the best one, right? Clearwater Family
yes,
Allergy. Yeah.
absolutely. So we
Okay.
do have her Instagram here for you guys as well. Clearwater Family Allergy. If you guys have any questions for her, please feel free to write this information down. Also, you guys can follow her on YouTube as well. All right. She also has a YouTube channel at Carrie Reller, MD, and she also has um, Facebook. Facebook as well. You can follow her on Facebook. I highly encourage you to follow her on Facebook. I think I'm going to follow her on Facebook as well. So before we get off tonight, I am going to click on to your group and I will be in your channel. I mean, be in your group on the Facebook, the Clearwater Family Medicine and Allergy as well. Okay, I think somebody just sent me a private message to ask you a question.
Okay.
Um, I'm sorry. Give me a minute. Let me read this to you. If a person that has bronchitis for years, can they develop asthma?
So the like bronchitis from a virus? I mean, typically, I
Well,
bet you,
bronchitis, I guess, from
yeah,
being a smoker.
it could
Just
be. There's many bronchitis. There's asthmatic bronchitis. There's viral bronchitis. There's chronic obstructive like
COPD
pulmonary disease, which
bronchitis. I
is
know, I know.
bronchitis.
I'm
So
thinking this
it's hard to
person might be the
differentiate.
COPD bronchitis. It might be that
Yeah.
one.
So there's a lot of crossover with COPD and asthma now.
Mhm, mhm,
So that's a whole nother topic for sure, like a
mhm,
COPD asthma crossover. But certainly anyone who's had bronchitis most of their life, they probably have asthma, they probably have COPD, or they probably have a mix. So
mhm.
it's probably not just a virus for their whole life, right? Yeah.
Right. All right, so we are coming up on 5 minutes of our show. All right, guys, we're coming up to the end. All right, you guys are going to have to type in your questions very, very quickly because I'm going to start saying our thank yous to our marketing people. Anyone that would like a free consultation with myself, Shay Brown Brown with Fit for Life, I specialize in um, health maintenance and disease prevention. I'm like, I don't know what's going on. I'm told you I've been writing papers all day. Um, my information is down at the screen. sbbfitforlife.org, or call 443-470-9140, okay? Schedule yourself for a free consultation. Definitely want to give a special thanks to JC3 Enterprises LLC, small owned, I'm sorry, disabled veteran owned small businesses. This is my marketing person, all right? This guy is totally amazing, does digital arts. So if you guys are looking for a marketing person, Carrie, I already told you
I'm writing it down.
I know he is an overachiever. Okay. Ask for little things and he brings me more to what I'm looking for. He is absolutely amazing. So if you guys are looking for someone that's in marketing, you can locate him. His information, I think, is at jco at jc IIENT.com. If you need a marketer, all right, this is the person that you want to call, contact. All right, he's doing all of my marketing. I truly appreciate him because you guys saw my marketing. It had my face and the title, and that was it. So he is making my job so much more easier. So again, if you guys need a marketer, this is the person that you definitely want to contact. Again, I'm going to put Carrie's information back up here because she is our guest, and I definitely want you guys to reach out to her if you guys have any questions. Again, here's her Instagram. Carrie, thank you again and again. I mean, I'm from the bottom of my heart. This really means a lot to me. I think we have a couple of questions, but I'm going to tell you this really means a lot to me. As a medical professional, you know that we don't get much time with patients.
Mm-hmm.
I get 15 minutes. I don't know how long you get, but I get 15 minutes and then I'm like, I have to rush to get another patient in the door. But we actually give people a whole hour to ask their questions. We give people a whole hour to educate them, to better, to give them the tools to better their own health. And that's better than the 15 minutes that we give them in the office. That's better than writing a prescription. That's how I feel. So again, I just want to tell you thank you. And my audience, they thank you as well. So yes,
Thank you for having me.
we appreciate you. Janine Cochran, awesome show. All right. So we have another one up, Miss Cynthia. So you've mentioned diet, and I have missed it, but I've heard specifically that dairy may affect asthma patients as well. Is that true?
So I think some dairy is inflammatory, so that could be related in an inflammatory component. Also, sometimes dairy increases mucus production, and that can often affect an asthma patient. But we did not talk about dairy earlier, so you didn't miss anything.
No, no.
But yeah,
Well, I did
mucus
mention
production
food.
and some inflammation.
Yes, I
But
did
I,
mention the
I
food.
don't say you necessarily have to avoid it. I actually think yogurt can be, pretty healthy.
It
So
can be.
yeah.
Yes, it can. Not
If
all.
if you look and make sure there's no added sugar.
All right.
Look at
Yes.
the label.
Read the labels. Yes, yes, we did mention that. Please read the labels. So if that is all tonight, it is now 8:59, guys. Again, we like to thank you so much for chiming into our show tonight. Again, we have Dr. Rella's information here. If you guys wanted to follow her on Instagram, or if you guys wanted to follow her on Facebook, please follow our guests. All right. This is not up here just for show. You guys know me, all right? You know I am the poster child for better health. And I'm not going to stop. I'm not going to stop posting these pictures. I'm not going to stop posting these blogs until I have reached every last one of you, all right? So thank you guys for chiming into another edition of Your Health Matters, because guess what? Your health, it does matters. God bless, and you guys have a wonderful night. Goodbye.